Good afternoon. Public health and public safety continue to be at the center of Boston's recovery, reopening, and renewal. I am joined today by Chief of Health and Human Services, Marty Martinez, as well as the Office of Police Accountability and Transparency Director, Stephanie Everett. Chief Martinez and Director Everett are providing important leadership in our response to the COVID-19 pandemic and the transformation of public safety in Boston. After months of extremely low and declining cases, we have seen a marked increase in COVID activity in Boston over the last several weeks. The majority of the people affected by the increase in COVID positivity in Boston are individuals between the ages of 20 and 39 years old. Our current test positivity rate stands at 2.7%, and as of Tuesday, July 27th, in Boston, we have seen 704 new cases in a 2-week period for a total of 71,914. This compares with just 147 new cases during the previous 2 weeks. Sadly, there were 4 new deaths reported in the last 2 weeks, bringing the overall total to 1,399. At the beginning of this month, we saw a 7-day average of 26 COVID-related hospitalizations. As of July 26, that number has risen to a 7-day average of 36 hospitalizations. In early July, Boston hospitals reported a 7-day average occupancy of 83% in non-surgical adult ICU beds, and that rate has risen to 88% in the most recent data. All of our tracking metrics remain below threshold levels and well below the peak of 2020, but they are increasing. After a year and a half of battling COVID-19, I understand many of us feel ready to move on from the pandemic. But let me be clear, the pandemic is not over. We are still living with COVID-19, and we must do all we can to keep ourselves, our families, and our communities safe. Vaccines are the best way to protect ourselves and others from COVID-19. Let me say that again. The vaccine is the best way to protect ourselves and our loved ones from COVID-19. In Boston, we have been leading the way, helping the Commonwealth remain one of the highest for the vaccine across the country. To date, more than 400,000 Boston residents have been fully vaccinated. Over 66% of Boston residents have received at least 1 dose of the vaccine. 90% of seniors aged 65 to 74 are fully vaccinated. In every neighborhood, with the exception of Mattapan, more than 50% of the residents are vaccinated. Working together with workers, businesses, and nonprofit partners, we can do even more. My goal is to have every City of Boston employee vaccinated. That has been the focus throughout this year. That is why we have set up priority clinics for teachers, police officers, firefighters, EMTs, and other frontline workers. It is why we've brought vaccine clinics to City Hall, and it is why we provide paid time off for our employees to get vaccinated. Even with these efforts, we know that some of our employees are still not vaccinated. With cases on the rise and the Delta variant now the dominant strain in Boston, I believe this is the best path forward to get every employee vaccinated. If it takes a mandate to keep the City of Boston employees safe, that is what we'll do with very thoughtful, worker-centered approaches. But we must do that by building the right plan for our workforce and for our vital city services. As we have done throughout this pandemic, we will follow the public health data. We will provide resources to make getting a vaccine easier, and we will ensure a high level of service to the public, and we will work with our public sector unions on any plan that we implement including a potential mandate. While vaccinations are the best protection we have, I have also strongly encouraged the wearing of masks during the course of this pandemic. The City of Boston is leading by example and requires masks inside municipal buildings, including here in City Hall, in our schools, in our libraries, and our community centers. When it comes to children under the age of 12, masks remain the best protection available. That's why School Superintendent Brenda Cassellius and I are requiring all BPS students and staff to wear masks indoors. This policy is already in place for summer school. It will remain in place as students return in the fall, and it is supported by our teachers union. We are taking important steps to make vaccines available to BPS students aged 12 and up. Chief Martinez is also meeting with charter and parochial school leaders to ensure every young person in Boston returns to school safely. We are also boosting vaccination in communities hardest hit by the pandemic. Our mobile vaccination efforts are meeting residents where they are and making sure that everyone has the opportunity to choose health and safety. As I said earlier, there is still more work to do. The COVID Delta variant presents a new threat to those who remain unvaccinated. The data now show that the Delta variant is the dominant strain in our region. This new virus is more contagious, more easily contracted, and more easily transmitted. The longer we linger with large numbers of unvaccinated residents, the more opportunity there is for the COVID virus to mutate again and prolong this pandemic. For Boston residents who have delayed their vaccine, please do not wait for the Delta variant to catch up with you. Now is your time to get vaccinated. We are driving vaccine access and information to those who need it most. For example, with over 60% of new cases in that 20 to 39-year-old range, we are working with restaurants and bars to discuss overlaps between their clientele and the new COVID cases. We aim to work with them on strategies for getting their customers vaccinated. We are providing businesses with social media graphics and printed flyers to post in their establishments, and we are also bringing mobile vaccination clinics to events, bars, and restaurants where the younger population is gathering. Now, I would like to turn to public safety. The Office of Police Accountability and Transparency has completed a review in response to my request to deliver a plan for review and reform of the police department's internal affairs procedures that allowed accused child molester Patrick Rose to remain a member of the Boston Police Department for 2 decades after an internal BPD investigation resulted in a sustained finding against him. I have released the results of this review today. Director Everett has identified the policies and procedures in place at that time of the Rose case and has issued recommendations to ensure this never happens again. The review included conversations with Boston Police Department officers, including the internal affairs and command staff. This work also included a review of existing rules, past investigations, and previous reports, including the 1992 St. Clair report commissioned by Mayor Ray Flynn. Director Everett has issued 3 key findings and recommendations. The first is that in 1995, the Internal Affairs Department did not act quickly, independently, or fully upon notice of a complaint. Since that time, policies and procedures have been put in place to ensure timely and thorough investigations. However, we want to go further. It is now recommended that the Boston Police Department's Bureau of Professional Standards seek to interview witnesses within 48 hours of notification that an officer has been charged with a violation of the law. The second finding is that the police department did not take sufficient steps to discipline or terminate based on the Internal Affairs Division sustained finding of misconduct. To address this, it is recommended that the discipline from Internal Affairs investigations be made visible, predictable, and just, and use a discipline matrix being developed by the Police Commissioner for the Civilian Review Board to use in its discipline recommendations. If a commissioner decides not to implement discipline recommended by the Civilian Review Board, they will need to justify that decision in writing. And the third finding is that there was no independent oversight of the Internal Affairs Division's investigations. To strengthen oversight, I will file an amendment to the OPAT ordinance requiring BPD to notify OPAT of criminal charges brought against officers. When the Internal Affairs Division receives information from the court, an officer's supervising officer, or another credible source that an officer has been charged with violating the law, a notification should be sent to the Post Commission and to the Office of Police Accountability and Transparency for the offense and the initiation of an investigation. In conclusion, this review found that the 1992 St. Clair Commission recommended a series of reforms that may have prevented Rose from remaining on the force and allegedly assaulting more children 2 decades after the Internal Affairs Division sustained a finding in this case. The failure to fully implement the reforms recommended in 1992 was a missed opportunity with very tragic results. In 2021, we have an obligation to ensure this never happens again. We must implement the 2020 recommendations offered by Wayne Budd and the Police Reform Task Force members, and continue to establish OPAT and its public boards with urgency. Since her appointment in early May, Director Everett has been steadfast in advancing several key police reforms, even as she works to staff the new OPAT organization. For example, and in accordance with the city ordinance, OPAT has solicited nominees to the new Civilian Review Board. First, in regards to nominating to this board, I submitted a letter to the City Council on May 21st requesting nominations for the Civilian Review Board by June 7th. The City Council finally began its process to nominate Civilian Review Board members last week and set an extended deadline of August 30th. Nominations from several community-based organizations are due in the coming days. Second, the new Internal Affairs Oversight Panel had its first public hearing in June. And third, OPAT has been working to coordinate compliance with the new state police reforms. As we build out the Office of Police Accountability and Transparency, the city and BPD have also been actively engaged in implementing other elements of a police reform agenda that includes, in April, the creation of a diversity, equity, and inclusion policy and launching of a DEI committee within BPD. In May, a revision of the use of force and bias-free policing policies. In June, the launch of a public dashboard that covers police conduct. In addition, we've also been working on de-escalation work for BPD officers and an increase from 2 to 8 hours of the fair and impartial policing curriculum for new recruits. Additionally, BPD is also drafting a new sexual assault policy and updating the domestic violence policy that I called for earlier this year. I am very grateful to Stephanie Everett for her work leading and building OPAT, and I want to thank Wayne Budd and the Police Reform Task Force members and the Boston Police Department for their cooperation and efforts to advance its policies to meet the demands for equity and justice in our city. Thank you, and now I will take a couple of questions. We are working toward getting every single city employee vaccinated. That has always been our goal. And we are leaning toward the mandate. What we want to do is make sure that we are being very thoughtful in our approach, that we are working with our workers, that this is a very worker-centered plan that we put forth. 90% of our workforce is unionized, and so we want to bring people to the table to make sure that we are doing this right. I have been in discussions with many of our labor leaders who represent our workforce, and they are excited to get their members protected as well. And so I am very confident with our approach that we will be moving forward with getting more and more of the workforce here, city workforce, which is 18,000, vaccinated. Yep, and so what I would also add, in addition to vaccinations, and we certainly want to make those easier for folks to get and make sure that people have the time to get it, for those who continue to have concerns for religious beliefs or other concerns, we are also offering frequent testing. Can you repeat that, Sean?
Sorry, yeah. Are you thinking about putting any other rules into effect or around COVID?
Well, we continue to lead when it comes to modeling the behavior that we want to see, whether that is wearing masks. We have, ever since I reopened the city, and obviously before the city was reopened, required masks in all of our municipal buildings. I certainly encourage those in the private sector to do what they can to protect themselves. We want to make sure that as we are dealing with this pandemic still, particularly with the Delta variant, that we're doing everything possible to protect ourselves and our loved ones. We know that the best protection is the vaccine, and it is why that we continue to work with community partners, including our community health centers, to make sure that it is readily available, that the information is out there in multiple languages, so that we can get every single resident in the city of Boston vaccinated. Yes. To be very clear, our positivity rate is at 2.7, which is the same rate it was when I reopened the city back in May. So we have seen the cases rise, which is why we are making sure that as kids come back into schools that they will be masked, and that we are strongly encouraging and working with our workforce to get everyone vaccinated. If it takes a mandate to get us there, that is what we will do. What was your question? You know, I think the department had a responsibility to act sooner. You know, I remain committed to protecting the privacy of survivors in that case, and so I am concerned about how much could have been shared at that time. Certainly, transparency should have been the order of the day back in 1995, 1996, and swift action should have been taken. It is shameful that it seems that the actions taken were to protect one of their own rather than to protect children.
On the Pat Rose report, it doesn't really delve into who knew what when within Boston Police, who specifically dropped the ball on this. Why wasn't that the focus of the report?
What is clear is that this charge was sustained by IAD and that this officer remained on the force for 20 full years. That responsibility is clear where that lies in terms of who gets to make choices of who is terminated. I cannot hear you, sir. I'm sorry, I cannot hear you. Well, we will continue to be informed by the data. These large outdoor festivals are, in fact, outdoors. And so there is a little more protection when we're outdoors. I think indoors it is incumbent upon all of us to do what makes sense to protect ourselves. Certainly here, I appreciate that all of you are wearing your masks.
Patrick Rose situation, I know there's been restrictions since then. Is there anyone in the department now that should or could be held accountable for what happened?
The police who were involved in that case at that time have all since retired. It is unclear to me whether there will be any effort in terms of criminal justice to look further into that. But they have all since, no one is working for the city of Boston who was involved in that case at that time.
Question, are you eyeing a particular increase in cases? Do you say that you should revisit indoor masks, for example?
We will continue to be informed by the data. Thank you so much.